Greetings and welcome to yet another episode of the Ugandan podcast, brought to you by the Ministry of ICT and National Guidance in collaboration with MultiChoice Uganda. Now, when we discuss emerging technologies, VR, AR, AI, machine learning, it sounds like something straight out of a science fiction movie, but this isn't fiction. This is actually a reality. There are Ugandans who are making leaps and bounds in this field of emerging tech, and I have a few amazing individuals who are going to spend the afternoon with me, and their titles read almost as long as their CVs, starting with Grace Kebirungi from the African Center of Excellence in Bioinformatics and Data-Intensive Sciences, where you are project coordinator for the VR lab. That's the virtual reality lab. Yeah. And we also have Martin Mukama, who's a senior prototyping and technology development officer at the Center for Innovations and Technology Transfer at the Makerere University of Sciences and Technology. And Dr. Sylvia Nabukenya, research scientist at the Makerere AI Health Lab at Makerere University. AI, short for artificial intelligence. My goodness, it's amazing. I feel like I've gotten through half the show just introducing you. But thank you so much for making the time to be with us.
And thank you for having us.
And it's incredible that we hear all these terms and we see them in the movies and we think that they are maybe Project 2050, and yet you are all working in this field. So it's a reality for Uganda today. Yeah. So if you could allow me to start with you, Grace.
Yes.
How is VR, which is virtual reality, at ACE where you work, intersecting with the health sector of all industries?
Actually, because of where I'm based at the Infectious Diseases Institute, specifically the research department. So our mission is to train health workers. And so specifically in 2019, that is the time when actually virtual reality came to bear at the ACE and maybe in Uganda, because at that time, we could not train the health workers the traditional way, where we'd have them come into our classroom and then tell them how to wear the personal protective equipment and all those kind of things, how to correctly wear the gloves and, wear all that. But because of that, we had to think of better ways of how to train the health workers.
Okay.
So we're thinking, how about we use computers to generate a virtual environment where we can be able to simulate this kind of training. So that is where virtual reality comes in. And that was actually our very first project, which was being able to train health workers on how to handle COVID-19 patients without infecting themselves.
So this was actually quite timely because, the exposure of COVID-19 was proximity.
Yeah.
And now you've reduced that risk altogether.
Yeah. So we're thinking of how could we be able to train the health workers without causing risk and without being in proximity with the patients and all those kind of things. So the technology itself really came in so handy. And that's when it came to bear.
And to think that this has been around for long enough. Oh my goodness. Yeah. So let's stay on the field of health with you, Dr. Sylvia. When we think AI, our first thing is ChatGPT. And yet there's a Makerere AI Health Lab.
Yes.
So how is AI also being used to treat real-world health challenges?
Yes, excellent question. So What actually Makerere AI Health Lab is doing currently, it has a lot of diagnostic tools that it's coming up with that are basically using AI. And these tools are basically trying to improve the diagnosis of diseases, especially TB, infectious disease. TB, there is TB, there is cervical cancer, there is malaria. These are some of the diseases that we're actually battling with in Uganda. And the diagnosis of these particular diseases need to be a little more accurate and precise so that the treatment that is being guided by the diagnosis is actually also appropriate and accurate. And so AI is actually trying to improve services in that capacity, but then also trying to make the diagnosis faster. We're trying to move away from the times when people have to go to hospitals and queue for so long just to get a diagnosis, simply because the current machines could be a little slower, and then also someone has to spend a whole day in hospital instead of finding other things to do with themselves. And so when we have AI at the forefront trying to assist healthcare providers in the whole process of determining what treatment is appropriate for someone, and then also what is the accurate diagnosis, we're trying to see that, yes, AI is trying to, help healthcare workers as well as also save patients time so that we become more productive citizens out there.
I know.
Yeah.
There's enough time spent on the roads,
Yes.
driving slowly.
Yes.
Let healthcare not be a
Already.
burden.
Yes.
Coming from healthcare into hardware, Martin, your field of expertise is prototyping and tech development.
Yeah.
How is your efforts supporting what it is that they do, whether it's in virtual reality or AI or even augmented reality?
Yeah, excellent question. Thank you so much. So I wanted to start by correcting you from your introduction. CITT is at Mbarara University of Science and Technology, not Makerere University.
Oh, sorry.
And under CITT, we have 3 departments. We have the Department of Prototyping and Technology Development. We have the Department of Commercialization, Manufacturing and Contract Services, and then we have the Department of Experiential Learning and Practical Skills Training. So I manage the Department of Prototyping and Technology Development, and under that department, we support students and staff with prototyping services that have ideas. And some of those ideas are actually in line with artificial intelligence, and some of them are actually in line with virtual reality as well. So there are a couple of projects that we have supported in that line, and there are services that we render to our students and staff. Things like model training. Some of them do not have the infrastructure to actually run the models, so we provide cloud services so that they can train their models and in turn produce the kind of technologies they want to develop. And we have developed technologies not only in health, but also in agriculture and other sectors. So that's how we augment what they do.
So you feed into what it is that they're doing.
Yeah.
Oh, that's wonderful. Well, you are all dealing in a relatively new field, and any new field has new challenges that haven't been encountered before. So in the virtual reality world of applying this to the health sector, what challenges have you faced that no one would, because it's new to us, no one would know about these challenges? What have you encountered so far?
Yeah, I mean, there are quite a number, but so when it comes to virtual reality, as I'd earlier mentioned, it's more of a simulation created by a computer.
Right.
And it's still an emerging technology in the sense that even the hardware itself is not that advanced to be able to create a real simulated, almost like real life situation. So for now, like for example, the headsets that we do have at ACE Uganda, we have the MetaQuest 3. But still, when we want to, and when we're applying it within health, like for example, we want to create a simulated environment where someone is able to, do surgery or be able to do CPR, the resuscitation. The headset itself can, when it senses the fingers, the way you hold or pick things within that virtual environment is by using the index finger and the thumb. And that is not as real or as close to how we use our fingers.
The real life application.
Yes. So now when we do introduce, like let's say we've developed a prototype on how to resuscitate a patient, we are going to do something like this.
Yes.
Where like the cameras are able to maybe pick
the motion.
Yeah, the motion, but only with the tip of the index finger and the thumb. So then a doctor will look at you and say like, well, that's not what we do. That's not what we do in real life. Like we don't just do a star-shaped kind of thing to do resuscitation. We literally have to interlock the fingers. And when you do interlock, sometimes the sensors on the headsets are not able to pick up the fingers. So that is a challenge. And then when you tell the doctors, but this technology will help you, and they're like, yeah, but it's not as near real world as would want it to be. So I mean, it has, virtual reality has very many advantages, but because of that challenge, it sort of makes the doctors a little bit reluctant to work with us in that sense.
So it's also hard to get the buy-in
Exactly, the buy-in
to its application.
Yes.
Okay.
Because of that small challenge. But yeah, we hope that now that there's advancement, like we've seen Apple Vision Pro
Yes.
being released and stuff like that. So we hope that in the next generation, even with Meta, they're going to be able to release headsets or even have our exactly. Like we could partner with them and maybe produce low cost headsets that would be able to, more tailored to our needs. Yeah.
Maybe even develop them in local languages.
Yeah.
That's true.
Yeah.
Yeah.
Wouldn't that be something?
Yeah.
And back to you, Dr. Sylvia. Like I said, you're both you're all working in a new space.
Yes.
Now, when it comes to anything that is new, we misunderstand it right off the bat. You're talking about AI in healthcare, and the first thing that came to my mind was, so now can I diagnose myself at home and not need to go to the doctor for advice? So I want you to speak to maybe some of the misconceptions that people might have about your field.
Thank you very much. And before I actually tackle that question, it's just to talk about that I'm a bioethicist, and I like to talk about the ethical issues that we experience out there. You've just mentioned one of them, which is basically the misconceptions about what AI is. Interestingly, AI is moving so fast, and we don't really have regulations and guidance on how to handle AI in research, in clinical care, in public health, as we are being very brilliant, coming up with amazing ideas and opportunities to solve our challenges. We need to think about the ethics and the social issues and the legal issues as well. So back to the question about misconceptions. Yes, the biggest challenge that I actually see is because people don't actually understand what AI is and what it is not, what it can do and what it cannot do. And we tend to have the preconceptions in our minds about how to figure out when we're going to use AI. I like the example you talk about when you say people would misdiagnosis could come about because we believe ChatGPT, you'd say that, go ask questions and then it will give you a massive kind of information about the problem you're trying to search or talk about. And you realize that if that you're using that information, you're going straight to the pharmacy, get what you want and move on. But there are other factors that involve how a clinician would decide on what medication is appropriate for an individual. So while we like to use the tools, it's amazing because I can be in my home and I try to figure out, why am I not feeling very well, today, and I need to find a quick answer. Oh, people, it's late in the night. I need to get a quick answer about this. So as you're trying to do that, or as a person who may not really have a clinical background, sit back and say, tomorrow morning, if it's very late in the night, tomorrow morning, I have gotten this information, yes, but tomorrow morning, I should head to hospital, I should head to the clinic and discuss this with a healthcare provider. Of course, it's important that also AI is helping to provide some kind of basic information to the patient or to anyone. And so by the time you get to hospital, you make it a discussion, a conversation, because you already have some kind of information before you get to hospital. Have a discussion with your healthcare provider so that you come to agreement on what exactly is your problem. And not necessarily looking out for some diagnosis that has been done by AI, but AI is actually giving you information to have an idea of what's going on with you.
So we need to appreciate that AI is a tool, not the solution.
Exactly.
It's just going to help me, but I ultimately still need
Exactly.
the clinical personnel. Thank you for that. So the challenge for you, Martin, I'm guessing, when it comes to tech and prototyping is funding.
Yeah.
How have you been able to bridge that funding gap?
Yeah. In prototyping and technology development, funding is a big hurdle. And I am sure that people from Makerere and IDI can testify to that.
Yes.
But we have been receiving some funding from government, which we appreciate. Government has been giving Mbarara University a total of 1 billion Uganda shillings for research and innovation. And we have been dedicating 70% of that to research and 30% to innovations.
Okay.
So our innovators sort of have some little funding that they can use to do their prototyping. But what we have also done is that we have equipped the innovation space in CITT with a lot of prototyping equipment, so that even if you do not have the funding, you can access the equipment and there are people to provide you the mentorship and coaching to come up with your solutions. And what we have seen is that for people that don't even have the funding, once they come to the lab and prototype with us and come up with the first prototypes, functional prototypes, they can be in position to access funding. Because we have seen that funders do not actually like funding ideas, but they want to fund tangible products that they can see that have been tested. So once they have access to that equipment, they can be in position to produce the tangible products that can help them to acquire additional funding. And we have also been mentoring them on how to write proposals for funding, so that you don't just develop and stop there, and you don't have the knowledge to look for funding, but we also train you on how to write proposals so that you can access funding. And each time we get calls, we always share them. Yeah, but we'd like, of course, to urge government to increase our funding. You know that Makerere is getting a lot of money in terms of innovation, and we have a structured system at Mbarara University. Actually, innovations are part of the structures of the institution. Yeah, so most of the people under CITT are drawing money from government as salaries. So it's all structured. So we would like government to actually increase our funding so that we can support more and more innovators, because we have seen innovators actually creating their own jobs. And we believe that universities can be hubs for creating employment, so that we can curb unemployment as well.
Skilled workforce from Mbarara University. So they're coming into the workforce well
trained,
versed and well trained. So you're making a solid argument for increased funding. It's not hard to justify. But you talked about partnerships. I mean, the government is funding the work that you're doing. For Grace, previously, tech had been operating in these silos. Everyone was just doing their own thing. We didn't know what the other person was doing. But there seems to be more collaboration when it comes to the tech space.
Yeah.
How would you say that it has helped you at the African Center of Excellence, whether it's across institutions, whether it's with policymakers like government? How has it helped you when it comes to the VR applications in the healthcare space?
Yeah. So first of all, I'd mentioned that we do VR in health, but for us to be able to do the prototyping or the scripting, we'd need people who are like specialized in that area. For example, I'll give an example for the current project that we are running at ACE Uganda. So we are doing a project that would teach the locals how to do resuscitation, CPR. Because, like when someone faints, if any of us fainted here right now, who of you would know what to do?
We would know to call the doctors.
Yeah, but with the traffic, and all those kind of things, the ambulance would take a while. Yet the time between you going to hospital and someone coming in to intervene is really so crucial. So we thought that virtual reality itself, because it's a type of technology that simulates an environment. So we thought that we could teach the locals on how to do CPR, so that they are able to do something as we're waiting for the ambulance or for the doctor to come in. So in order for us to do that, we actually need medical doctors, like experienced medical doctors, to guide the tech team on what to actually do and make a correct representation of what would happen in real life if someone wanted to do CPR. So definitely for us, it's in tech, or specifically for the projects that we've been doing, we've been engaging mainly with doctors. For example, for that project, we're engaging with an emergency medicine specialist, one that would help us sort of know the different steps that we need to develop or that we need to represent within the virtual space. We also need, even within the tech field, you'd be amazed that there are different specializations. Like we do have a 3D graphic designer or developer, someone who will be able to sculpt you in a virtual environment, and it needs to be like recreating you in a virtual space, and you being able to sort of move in that.
And this is happening here in Uganda.
Yes, it is. You should come to the lab when you get time.
I have to.
Yeah, so we need, and that kind of person just does that. Make sure that you are well represented, or you are you're built the way you are in a virtual environment. But then there'll be another software developer who will come in and try to, now that you have been put in the virtual environment, how can we make you interact with virtual objects?
Yes.
Yeah, so there'll be someone else who will be responsible for that interactivity. And then in the end, we also need to, not roll out, but to have the public, a small group of people in the public to do some pilot testing to test and see whether actually what we are developing is something that people would want to eventually use.
Right.
So we'd also need some people from either social sciences, people from project, management kind of fields to come in and, work with us to ensure that the whole pipeline from development to finally piloting or production comes together. So for us, there's no way in tech, there's no way you can develop without having different, having different partners. Yeah.
And your field is one that everyone is requesting for proof of concept because funding in your space is extensive. Because I mean, if he's receiving $1 billion and he's saying it's still not enough.
It's actually really not enough because when you think about the purchase of the equipment itself is fine, but then there are also all these other things like the software you'd need,
right?
Like to develop, and then there'll be there's so many things that you need to take care of. So in the end, I know it's 1 billion, but if you're sharing it with different researchers, people who would also need to do, like, let's say, clinical trials, all those kind of things, we appreciate, but
please some more.
Yes, please add some more.
You want to Oliver Twist.
Yeah.
And you've also spoken about the funding element of it. And Dr. Sylvia, I would also like for you to speak on that because AI also requires funding. And you're all using emerging technology in meaningful ways. You're making impacts, you're solving real world problems. So there's someone who has seen Dr. Sylvia, someone who has seen Grace, someone who has seen Martin, and they're hoping to use AI in a meaningful way, but they do not have access to this funding. Where would someone begin if they want to, let's say, assist you with what you do?
Good question. I like discussions about money, especially funding. So basically, what I would say, it's more of collaborations, and collaborations involve, I would say, collaborations will involve having several key stakeholders coming from different disciplines and coming together with an idea to see how to solve certain issues. For example, I would just describe how probably the AI development process would look like. One should actually start by doing a community engagement, whereby you find out from the community, is this what we are proposing or what we have in mind, the concept we have, is it something that will solve your problem? And so if they say, yes, it's something that will actually tackle this problem, then let's move ahead. Let's see how to build up a team. So we'll have different key stakeholders. We'll have the clinicians, healthcare providers. We have the software development team. We have language experts. We'll have people from the health economics to find out if the two we're trying to build is sustainable at the end of it all.
Right.
And then we have come up with an idea, proposal together in a collaborative manner. Then try to find funding in different spaces. Yes, government of Uganda is one of them, but then there are also other foreign, entities where we can approach and say, look, there is a brilliant idea here. I don't know why I would say Google, but yes, there's a brilliant idea here, and it's tech basically, and we're trying to use innovation and technology to advance the way we do things and also meet our challenges. What do you think about it? And then probably see how to partner and solicit funding. But also the other thing that I realized is, who do you meet? Who do you talk to when you go for conferences? Embrace, speaking about your work, your next steps with different people. Utilize social media platforms like LinkedIn. Whenever paper comes through, whenever you're making a talk show about something, talk about your work. People will get to know you and will want to collaborate with you. And of course, it's good to do international, national collaborations, so that we kind of borrow or learn from one another. And then there's also some form of technology transfer, so that we are able to appreciate and move on on the pace of other people, because we are learning, we're benchmarking from others. So basically, it's we need to be out there to speak about it. To speak about what we do.
Yeah.
And I would like to supplement, and funding should not only be in terms of money. Sometimes,
Right.
For example, you're spending about $2,100 for compute on Amazon Web Services to train the AI models per month. That's about 7.6 million that we are spending for compute. And if we got someone that gave us a server, for example, that has the compute, and we installed it maybe in a data center like in NITAU, then for us would be happy because we'd have saved about $2,000 per month.
Yes.
So we're also looking out for such people that can give us the infrastructure, for example, that we need, that we can leverage to do the work that we do.
Yeah. And I feel a little bit ashamed now. I feel ashamed because we actually do have a data center. Maybe we've not done a good job at, publicizing and letting people know that we have a data center. We do have servers that have almost, 1.5 petabytes of storage and
What is a
memory.
petabyte?
That's storage.
It's like one, big space. Like
It's how many
one
terabytes?
times. It's about 1.5 terabytes. No, about 15,000. Yeah, about
15,000 terabytes.
No, not 15,000 terabytes.
1,500.
Yes, 1,500 I think
Terabytes.
it's about that. Yes.
And that speaks into maybe the next area that I was going to
so that's
direct
why,
you to.
so that's why I was feeling a little bit embarrassed because we do have a data center, actually a high performance computing center. We also do AI, by the artificial intelligence. We've been able to create some applications that we've used with a couple of health workers.
Oh, wow.
So we do. Please do reach out after this. Please do reach out. We do have a high performance computing center, and leveraging collaborations, as you said, is also something really that you should maybe be looking at more. And maybe as she was talking about the funding, and he spoke about us having prototypes. I was thinking that maybe where the government would come in is in the sense of adoption, being able to adopt the technologies that are developed within Uganda, because most of the times the funders ask us, so where have you used this technology? Where has it? How has it impacted people?
Real life application of the tech you're developing.
Exactly. So if, for example, we are developing, like, let's say, a virtual reality course, and maybe would want Makerere University or Mbarara University to use it within their classes. Is it something that Ministry of Health or Ministry of Education come out and say that, let us have a look at your application. How does it align to our curriculum, and how can we help you work with it so that it aligns very well to the curriculum and people can be able to use it in real life? So apart from the funding, I think the adoption would really be nice to help us show actually that this technology is not just words, it's not theory, that it is actually being impactful and useful to people.
So I guess all your submissions then speak to a collaborative, a conducive tech ecosystem, if you would. And we've given the examples of funding through government and adoption through government. And in your space, Martin, how else can maybe government, if you have any more ideas, and how the private sector can also collaborate to feed into this conducive tech ecosystem, so that now you'll know earlier about their center of excellence and their supercomputer with petabytes that I'm learning about today. So how can we create a more conducive tech ecosystem where you won't have to wait for funding, you won't have to appeal internationally for funding, you won't have to put out calls of help us?
Thank you. So at CIT2, we have a structured innovation ecosystem that we take our innovator through. For example, for the arm of prototyping and technology development, we know that we partner with the public, we partner with staff in MUST, we partner with student innovators to generate the ideas that we support through the Innovation Hub. And then the money that I talked about, actually the 30% of the 1 billion, is what we use
Goes
to
into
give
innovation.
innovators. So we always have a call for proposals, and must actually applies, responds to those calls using that money. And then we fund up to 21 million those innovators, and then we still support them with mentorship and coaching all the way up to commercialization. And there are some structures that we have put in place. For example, we have the Mast Holdings Company, which is the commercial arm of the university. So even if a student comes up with an idea and they are struggling with commercialization, they can commercialize through Mast Holdings. And once they have stabilized, they can create their own spin-off and run independently. Also, Mast is CITT is a Technology Innovation Support Center. So we partnered with Uganda Registration Services Bureau. So we are registered as a TISC. So we help identify IP, applicable IP, and then we call URSB on ground so that they can file the forms of IP that are applicable to our innovators. But something else that we have been trying to do in order to bring the general public and other sectors into the space is we want to start looking at problems that they are facing so that we can address those challenges through our lab. We can give them to students, they can work on them, and then we can take solutions back to the public or to the different organizations that submit those challenges to us. So that way we can have sort of a collaboration with those organizations. And we also feel that will help us to solve the actual challenges the organizations are facing. So for example, if the Ministry of ICT is grappling with a specific challenge, you just throw it to us, we throw it to the students, students can pitch the best solution, and then we can work with them to come up with the best solution. And then we can start consuming our own tech that is developed by our own.
Basically, you want to create rapport with the government as well, so that they are not worried about Mast's capabilities when it comes to developing tech. They know that, no, we have this covered. We can go to the African Center of Excellence and everything. So that's a good way to look at it. Now, next one, I would like to appreciate the fact that the tech space is normally predominantly male. And I'm happy that I have two ladies who are making strides and bounds in the space. But I also would like to ask for you, starting with you, Grace, if you could make a submission to a young woman who's watching the Ugandan podcast and she didn't even think that virtual reality could be applied to the health sector, much less something that she could venture into, because we do have the youngest population in the world with the average age of the country being 17 years. So there's a solid chance there's a few thousand 17-year-olds who are watching and they're saying, oh my goodness, she's using virtual reality for health. What would you have to say to someone who's considering going into emerging technologies, into maybe not conventional fields the way that you did?
And, actually, virtual reality itself, it speaks more to the character, the woman character that women do have, attention to detail.
Okay, yes,
and,
true.
And remember that virtual reality, it's the way for it to become successful and usable, you have to make the environment appealing and very comfortable. Because remember, someone is putting on this headset, it's cutting them off the real world. So that space that they're in better be nice or better be very comfortable and, that kind of thing. So for women, I believe that this is a space that they can get into where they can direct or help the developers say that, maybe the speed at which people are moving within the virtual environment is very fast. It's going to cause people to maybe
become nauseous,
that kind of thing. Or so that I think you've not really brought up, when I look at the picture of this human being and what you've created, they don't look similar. That attention to detail, if you bring it to virtual reality, it makes a very big difference. So for women who are worried or who do not know where to get into in terms of the tech space, I think you could start with virtual reality, because they would bring so much to that. At least personally for me, that's what I do for my team. I'm like, you guys, I know you said that, but the nose doesn't look like this nose. Or the hands are not, the hands don't look like that or something like that. So would need the women would really add so much to virtual reality.
And
Yeah.
that actually makes perfect sense, but I never would have thought of it that way. I mean, yes, you do need attention to detail.
Extreme attention to detail, because even the doctors themselves would be like, so the human heart does not look like that, or all these different parts of the human body, like for you to, and sorry, I'm talking about in terms of the health space, like you would need the doctors to be able to trust you and want to adopt and use that for teaching, to supplement their teaching. They need something that is close to accurate. So I believe women, because for them they pay much more attention to detail, they would excel at that. But also when it comes to developing like the programming itself, they do have a place there. I know there's the course computer science, and it does teach people how to program, but for you to be able to transition to real world programming, you'd need a place that would sort of help you be able to practice. And at the African Centers of Excellence, we are very intentional about having women. We have an entire program that sort of encourages women to come into that tech space. We call it She Data Science. So
that's nice.
Yeah. So so there are so many opportunities for women out there. Please do not sit back home and say you're not, like there are no jobs. Please come and, I don't know, do internships, because at the end of the day, what most people do is that they want to just go to school, then have a job. But the transition between what you actually studied and how it can be applied in real life is different. And sometimes, especially now with these emerging technologies, most of the times you're not going to find like so many projects like the way they are, like the way the WASH projects, like the ones for sanitation and stuff like that. There are not as many. So you would need to prep yourself, be prepared. So get into an organization or an institution that is already doing that. Better yourself so that when the project comes in, then you are ready. You're not going to start learning there and then, because the learning curve is going to be so high for you. And yet we need deliverables. So the men are the ones who are so, like, they take on the risks. They're like, oh no, let me go to this organization. Let me try to pick up these skills and stuff like that. So they are good at taking on risks. But I think the women are a little bit risk averse. So I believe that if they get into these organizations that are already doing the work, invest time in trying to learn, then they'll have equal opportunities.
Okay. Thank you for that.
Yeah.
And for Dr. Sylvia, I would like you to speak on that as well. But then also, I want your question to be two parts. So if you could tell us, you do interact with young people on a daily. You've seen the future of Ugandan innovation with regards to AI. How do you feel about where we're headed with the current breed of young people that you interact with?
Yes, good question. So one, let me first go back to the issue of having women in tech. In 2021, where I was managing a project called the Course Project, and we used to talk about gender biases all the time. And why we used to talk about this clearly is because we had a sample of trying to do Google, and we say, who is a doctor? Who is a nurse? So Google was kind of brought us pictures, images of a doctor should be a male and a nurse should be a female. And then I also sampled something on who is the executive director, and then they still bring you a male. Reason being, I think certain AI models have been wired to think that certain positions are meant to be for men. And so I do agree. It's a patriarchal society, but women are out there as well trying to educate themselves, empower themselves so that they can also be fit for this kind of positions. Yes. And so for me, my take on women, girls right now is we need to have AI that serves the needs of all of us, not a few, because it's been trained to serve a certain group of people in our community. We need to know that if we need to be heard, if we need our needs to be met, we also have to participate in science, technology, as it merges and as it sprouts. So it's a very good thing that we really need to advocate that we have balanced kind of needs, AI that's trying to address different needs. Yes. So now back to your interesting yes, back to your interesting question. So when I look at how we are moving forward and the current situation right now, I know it's like I'm forgetting my statistics on that area. Everyone kind of in that particular age group has a smartphone. And this smartphone can do so much by telling you all different information, your social life, your how you exercise today, how many steps you made. Like you, digital phones actually, like smartphones are giving us a lot of information about ourselves,
Yes.
and it's high time we embrace it and and move together with what AI is offering. But I would like to also say that we need to do this in a cautious manner, especially when we know that every good thing has a benefit, but it can also have certain risks if we do not exactly know how to tackle with them. So it's something to understand that also AI is developed based on the available data. So we know that AI is data hungry. It uses big data sets, retrospective data, primary, secondary data, name it. And so we need to understand that if we don't have concrete data sets that are very representative of the different age groups, the different sexes, the different health conditions, we may not, certain people or groups of people will be missing out on the benefits that AI could actually present. So my key appeal to the government today, as Grace has mentioned, that S has a what? What?
Data science.
Yes, okay, data science has
Yeah.
like big space for data, and I know also Must also has a group of people or students they're actually supporting. It's important that actually the government puts into consideration having a national data storage facility whereby we have as much as clinical data. First of all, clinical data is collected on a daily and different health, places, whether private or public. There's a lot of data being collected on a daily.
Yes.
So can we have like a center where data can be found? And then when we have developers like the students, Mass is supporting, S is supporting. And so if there is a one-stop center where we can have this kind of health data available, then we can actually speed up the process of developing these tools and improving them so that they can actually meet the current and the future needs. So I think that is my big appeal.
Yeah.
Because it's something that many developers struggle with, as well as researchers trying to come up with these tools. Data is scarce, and appropriate reusable data without missing components like data. Data is a big problem. And it will be
Complete
an opportunity.
data is the
Complete
problem.
data. Yes.
That's
Right.
actually very true because we have a project at Mbarara University. It's a must data science research hub that is focusing on collecting imaging data sets so that we can later apply, AI models and build products that are representative of our population. So that's very key. Yeah.
And actually, yes, and moving on to that particular one, much as we're kind of harvesting all the data we can get, it's also important to have the ethics at the back of our minds.
Right.
Like, are people aware what that data is being used for? Of course, you've mentioned the large image data sets. And do they know that it can actually be used for commercial purposes? Who knows? So how do we get those consent modalities that give them an opportunity to know what the data is doing and how they've actually also contributed to society so that they will actually get a better buy-in when these products are actually made, that yes, we're part of the development of this, and yes, it's kind of addressing our needs and we're part of it, so we embrace it. And we, even some tools may be may require someone to pay, but because they know they were part of it, they know they own it, it's another way of not fighting so hard to ask Ugandans to pay for something.
Yeah, that's very true. And for the data that we are collecting, we consent everyone that provides the image. Yeah.
Oh, that's good. So I also want you to speak to the future of the Ugandan tech space. You do interact with these young people the way that Dr. Sylvia does on a daily basis. And you do have the real world experience of how emerging tech is being received in Uganda. What do you think the future of Ugandan tech development looks like in terms of our people, in terms of the infrastructures in place, and the things that are being set up currently?
Yeah, since we are talking AI, I would like to start by saying that there are 3 pillars of computing that are going to define our future, and artificial intelligence is one of them. The second one is gene editing. I know some people have been researching about gene editing a lot.
Gene editing?
Gene editing,
Like the
editing,
human genes?
like the human
You can edit
genes.
that?
You can edit that. Yeah, that's going to define our future as well.
Okay.
Yeah, and then the last pillar is quantum computing. So you can see that AI is at the top. So in terms of how our young people can look at, or how we can support them, I sometimes look at shared spaces, like shared spaces and shared infrastructure. Like I've been talking about compute. We've been struggling with compute at Mbarara University.
Yes.
If someone wants to train a model, we know we are spending a lot of money. But we also know that government has like a national data center. And what we have done for us from our universities, we are applying to NITAU to provide co-location so that we can put our servers in their shared space and we can access them remotely and still build our models. Not just as the researchers, but also the students can access these servers. Because we know that within our institutions, sometimes we have power outages, we don't have access to very good internet, but having these servers in such an infrastructure or such a data center will help everyone access such a resource. Yeah, and of course, we also want to sort of popularize innovation hubs. Yeah, so things like CAMTech, like at MAST, is dealing in medical technologies. We also have hubs that are dealing in natural therapeutics. We've had where COVIDX came from. Yeah, so we want that kind of ecosystem to be at institutional level, like at universities, so that students can actually learn. They can learn how to bridge. He talked about it, how to bridge academia with industry. That bridge is actually lacking. Because I work a lot with students, sometimes you ask them, okay, what are you good at? You're going to go into industry. What are you going to offer? And they can't answer that question appropriately because they do not know. Yeah, so if these hubs are premised in universities and they are training students on how to bridge from academia to industry, then we'll see more skilled students graduating, but also see students graduating with potential businesses and they can create employment for themselves.
As opposed to going to look for potential
jobs,
employment. And they're actually solving real world problems because that's exactly what emerging tech does. Well, thank you. I feel a bit smarter, just a little bit smarter after this conversation. Thank you so much for your time. But before you go, you are Ugandan first. And it is safe to assume that you are listening to Ugandan music. Can you each tell me maybe your top 2 Ugandan songs at the moment?
It's a tricky one for me.
Or maybe not even a song, maybe an artist that you appreciate at the moment. Let me start with you. Oh, you want to go first? Okay.
He may be saying my answer.
So, since I'm from the West, I like Reggie.
I like Reggie too.
Yeah, I like Reggie. And then from Central, am I forgetting her name? Forgetting her name. I can go next.
That's amazing. I know this is going to become a very big surprise to you guys because of the age bracket. But I really like Jose Chameleon.
Who doesn't like Chameleon?
I really like his music. There's so I really like Forever. And you guys have had Forever. Diva. I really like I listened to the live version of that song and I just fell in love. So I really I like Jose Chameleon. And then for female artists, guess.
I don't know.
Who
should I say? Because
that's what I'm talking about.
Yeah, exactly. I really love Azawi. I love her unique voice and what she brings to the music industry. So for me, those would be my best.
She is very talented.
Yeah,
Extremely talented.
Yeah.
And she has worked on perfecting her craft.
Yeah.
So that's your second person as well.
The name came back to me.
Yeah.
And for you, Dr. Sylvia?
Okay, I think I don't know if I'm the off one, but maybe I would go for Juliana Kanyomozi because I like the gracefulness in her music. And yes, I like to be a little calm, like the way she's composed and calm when she's singing. So maybe.
Juliana, and anyone else that you like?
I am just forgetting the person of head, but We can still just go Juliana. I swear.
Juliana.
Forever to
Well,
get
she's
me
a
around
timeless
someone.
classic.
Yeah.
But thank you so much for your time. Thank you so much for sharing information. I have
Yeah.
my work cut out for me. I have a lot of research that I'm going to look into. But petabytes is still, it still confused me.
Oh, yeah.
But I do appreciate the effort that you guys are putting into your spaces. Emerging technologies is still such a daunting task, and so many people look at it as this foreign field, but you've brought it home and you've showed us that it's realistic and it's actually solving real world problems. So thank you for that. And thank you for watching the Ugandan podcast brought to you by the Ministry of ICT and National Guidance. Learn that you can also solve real world problems. AI, VR, AR, machine learning is not just some foreign concept, it's something that you can actually bring home and do it well. Until next time, stay blessed.